From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
(10:54) on this Monday morning. There's been an awful lot of talk on how health care reform might affect patients. I don't think there's been nearly enough talk on how it would affect physicians. Dr. Gupta is with Radiation Oncology Associates in Radiation Oncology. Let me get that right, Dr. Gupta. And she's a frequent contributor here on News Channel 8, and we always like to see her. Welcome back.
Well, thank you.
I don't think that we've paid an awful lot of attention to, you've got insurers, you've got physicians, and you've got patients, and it's supposedly three equal sides. It rarely works out that way.
Right.
But we haven't heard from the physicians that much. The president went to the AMA and spoke to the members there, but the AMA is not a completely universal organization. They're not all physicians who are members. So I'm turning to a physician that I know and trust on this to give me some personal feelings. What do you think? How should this all shake out?
Well, I think what you're seeing now is how complicated and difficult it is to change a country's healthcare system. And we have an approach to healthcare in this country that's a bit different than most countries, frankly. Mm-hmm. I think you don't hear too much coming out of physicians right now because, frankly, as physicians, I don't think most of us really are too bothered with where payments are coming from, whether it be the government, whether it be the insurance company, whatever it is. You know, we're trying to take care of our patients and do the best that we can for our patients. So I think physicians have been somewhat silent on this, maybe not rightfully so, mm-hmm. but you know, there's so much noise and ruckus being made right now that I think we're all, as physicians, waiting to see basically what happens. Because, as I said, you know, we want to provide quality care. And it doesn't matter to us where payments are coming from. Should
physicians be a little more proactive, though, in all of this, do you think? Because they are a very important... This triad here, and if we know anything in this town is that if you're quiet, you're liable to get run over by the bus that's going right over the top. Something is going to happen one way or the other, and if you want to be a part of it, you need to be in it, not underneath it.
Well, I think that's the problem. I think as physicians, we don't actually feel we have much control over where this is going. You know, we're on the front end, but with little control. And, you know, it's very difficult to take care of patients and still be involved with all this other stuff.
And that is your job, above all else, is to take care of the patients. This has become a very emotional debate. In your practice, do you get questions from patients? People say, what do you think about this?
Well, we get questions, you know, dealing with cancer diagnoses is one of the most frightening diagnoses you can get.
Yes.
And then on top of it, when you add on all these insurance issues and complaints about, I don't understand this, and why isn't this covered, we spend a lot of time doing that kind of education, and it is a very difficult thing to focus on. Okay, let's not worry about, you know, all of that. We'll work you through that. Let's stick to what you need done. And so I spend a lot of time, you know, discussing those sort of issues, but trying to focus more on what you need to get through this diagnosis, because that's my job. So,
Dr. Gupta, thank you very much. Appreciate it. We'll be right back.